Hey Rebels, how is it going out there? My name is Carrie. I am a wife, mom, and nurse practitioner from Texas. After years of killing myself at the gym, I found myself still overweight and miserable. But I lost 55 pounds with Code Red and rid myself of constant chronic joint pain. Let's talk about medications. I know some of you are on medications, maybe a lot of you are, and there are a few that we need to talk about. We also have a lot of people coming in here into this group each and every day, and I just don't know if this has been discussed lately, so I think it's an important topic, and I just wanted to share it with you. So I am a nurse practitioner, and I see patients in a clinic, and most of my patients, a large majority of my patients, are on blood pressure medication, diabetic medication, and thyroid medication. So those are the most common ones that I see, and they are the ones that need to be adjusted as you lose weight. So I want you to be aware of that. Blood pressure medication, diabetic medication, and thyroid medication. Now, I also want to mention that in my discussion of diabetes today, I am referencing type 2 diabetes, okay? Not insulin dependent type 1. That's a whole different ballgame. But most commonly, I'm talking about type 2 diabetes, okay? So I just wanted to make sure that that was clear. So first of all, great job for being here. I love it. I love it that you're here, that you're taking your life back, and you are losing weight, feeling better, all of those great things. And it's just going to keep getting better. Now, it is important as you lose weight to pay attention. If you are on any of those medications will need to be adjusted as you lose weight, okay? So, first of all, I want to mention to make sure that you are working very closely with your provider, physician, nurse practitioner, whomever you see that manages your health and medications, that you are working closely with them and following with them, okay? Make sure they also know that you are actively trying to lose weight. Now, they do not need to know specifics, doesn't matter. Unfortunately, I know a lot of health providers are not as open-minded to this program. They don't understand it or even know how it works or anything like that. So sometimes it's best not to give any details, just I'm trying to lose weight. Because what provider is going to be upset about that, right? We all want to reach our optimum health and lose weight and be healthy. So nobody's going to be upset about that. So just tell them you're trying to lose weight and you need to be monitored as you are doing that. So that is where I want you to start. Now, blood pressure, let's talk about that. If you aren't, it is a good idea to start monitoring your blood pressure at home. You can get a cuff if you don't have one. You can find them at any pharmacy. They're not terribly expensive, and it's a great, great tool because it's a good idea to monitor your blood pressure at home when you're in your normal environment, nothing much going on, and you can check and get an accurate blood pressure. Because when you're in the doctor's office and they may be drawing blood work and coming in and out of the room and there's a lot going on, sometimes your blood pressure will be up a little bit. It's very common. So even when you don't have blood pressure issues, it can be higher when you go to the doctor. So make sure you're monitoring it at home several times a day, however often you feel like you need to do that. Don't be obsessive about it, but just a few times, and jot it down in a notebook. And keep that so you can go back and go over that with your doctor, provider, whomever. And it'll be a good representation of what your norm is, and then they can adjust medications if needed accordingly. So it's a good idea to do that. The next thing is if you're taking diabetic medication, again, type 2 diabetes, if you are on any medications for that, you should be. If you're not, you should be monitoring your blood sugar several times a day. As you change your diet, as you start following the Code Red program and doing all these things, your health is going to change, your weight is going to change. You're going to need to adjust the medication. So the need for that medication is not going to be as great. So that needs to be monitored as well. So you'll be checking your blood sugar, again, writing it down in your notebook. That way you can go over it with your provider and you can kind of see where you are. You'll also be getting that 3-month check, the A1C, if you know what that is. If you take the medications, I'm sure you know what that is. And that is a good average, a good number to follow for what your average blood sugar usually is. So you'll be following with them on those every 3 months or so. And that way you can see how your medication needs to be adjusted, okay? Thyroid medication, the same way. These medications, and for sure thyroid medication, even as you start out on that medication, it is dosed by weight. Your weight is figured in to see how much you may need to get started with. So it's titrated that way. So as you lose weight, theoretically, you're not going to need as much of the medication. So that needs to be monitored with blood levels as well with your physician, and that can be adjusted too at whatever interval your provider decides that to be. So it's important to monitor all of those things, to stay in contact with your physician, and to adjust those as needed. Now, I am not telling you, disclaimer here, I am not telling you to stop your medications. I am not telling you to cut your medications. I'm telling you to work with your provider in order to do that together. So that way it's managed the best way that it can be. You're at your optimum level and you're not taking something that you don't need to take, right? The goal is to get off of the medication. You may or may not be able to do that, but that's the goal, right? Nobody wants to take it forever. And a lot of rebels have been able to do that successfully, to get off of their medications. So again, these 3 medications, blood pressure medication, diabetic medication for type 2 diabetes, and thyroid medication, all need to be monitored closely as you are losing weight, and doses need to be adjusted with your provider, okay? I just wanted to make sure that you were all aware of that and paying attention to those things and working closely with your providers in order to do that and to maintain the best possible health and feeling as good as you can, okay? I hope this helps you in some way, guys. Thank you so much for watching. Until next time, I will see you in the group.